we have that responsibility, as you as researchers or any person in these in pressure work has the responsibility of coping up and performing well. But at the same time, we need to know that we are human beings. We need to take care of ourselves as well. No matter how busy the schedule is, we need to have a 3 meals course to follow. Eat on time, always sleep on time, no matter what. Eat, drink a lot of water, have a brisk exercise session for yourself in the day. Avoid caffeinated drinks always. And at last, always have that rest.
Biopatrika, your very own online science communication, brings science closer to you in many ways. Today, PsyConnect by Biopatrika welcomes all science enthusiasts to our Mental Health Awareness and Acknowledgement podcast. I, Smriti Sharma, and my co-host Charu Gupta are proud to welcome a psychiatrist power couple, also known as the Mental Health Guides.
India has about 9,000 trained practicing psychiatrists at present. This means 0.75 psychiatrists per 100,000 people. A desirable number would be anything over 3 per 100,000. Punjab, the harvest state of India, suffers from a massive drug abuse problem. 1 in 8 Punjabis suffers from mental illness, and 80% of these are unable to get treatment. This is just one state. Piyush and Malvika Mahajan are practicing psychiatrists from Punjab, India. They are a rare power couple who have taken up this caveat as a challenge to overcome. Their work with drug abusers, their disturbed families, as well as people coping with stress, brought them to start a mental health channel on Facebook and YouTube, where they share insights into illnesses such as insomnia, depression, anxiety, and OCD. They share relaxation exercises, and above all, they bust mental health myths. We are very happy to welcome Piyushika to our podcast.
Thank you.
So let's get acquainted with some terminology at the offset. How is a psychiatrist different from a psychologist or a counselor?
Basically, we can keep it in 3 forms. There is a psychiatrist, there is a counselor, and third is psychologist. So basically, psychiatrist is a doctor who has completed his MBBS of 5 years duration. Afterwards, he pursues a master's degree in psychiatry. And after that, after the completion of MD in psychiatry, he is labeled as a psychiatrist and he's free to practice. Whereas other fields like counselor and psychologist, they are a bit different. Psychologists and counselors both are non-medicals. They are not doctors. They relieve our mental health problems through some strategies that are different from drugs. So basically, counselor works on more superficial part of those conflicts, and psychologist goes deeper into those conflicts. For example, I'll mention a situation. For example, someone had a breakup, and due to that, he or she is stressed. A counselor will deal with breakup in direct relation that the symptoms the patient is presenting with. He had a breakup, he's suffering from depression, he has anxiety. So he'll counsel him accordingly, ki do not worry, you'll find another one, everything will be good. And whereas a psychologist will go deeper into the roots, might be the patient or his family members had a disturbed past, his mother had also a divorce. So a psychologist will go deeper into the roots and bring out the actual reason for that disturbance. Patient might have suffered that mental trauma while seeing his parents being divorced, and he is or she is reliving that trauma again when he or she himself is facing the same conflict. So basically, this is the main difference. Psychiatrist works as a holistic person. He works both as a psychologist and as a counselor, whereas a psychologist cannot work as a psychiatrist, counselor cannot work as a psychologist. So everyone has different roles, and psychiatrist is the best person who can prescribe medications. He's the first person someone should approach first, and he will further designate the patient whether he should need a psychologist or a counselor
Okay. So there are several papers written about people's like mental health and what are the issues. I would like to know that is mental health such an important factor, and do you think people still consider it as a casual term or it has much deeper definition?
Right. We all know that mental illnesses these days are growing. So people at large are becoming more aware of the fact that it is not only rooted to the social circumstances we are dealing with. We know that there are neural pathways which are involved in different illnesses, mental illnesses. So yes, it is as important as any other medical illness. It is as important to be treated like any other medical illness, and it is growing. People are becoming more aware about it, and people are actually coming to us for proper medical treatment for the same.
Yeah, but isn't saying that, oh, I'm so stressed, I'm feeling mentally ill, like a very social media cool thing which is happening? Like, people, if they're just a little bit sad, they just exaggerate it. And so, I mean, how is there a way of actually figuring out whether this person's just trying to be cool, or if this person really needs help?
That we can identify by interviewing him further, interviewing his family members, understanding whether all these difficulties are actually causing social and occupational and personal impairment to him. Is he not able to cope up with his social relationships in society? Is he not able to work? Is his mood actually interfering with the work of the whole office? Or is he not able to take care of himself, not able to sleep well, not able to eat well? If it is actually impairing him or her, it is actually a psychiatric disorder which needs to be dealt with psychiatrists in the first forehand.
So many times in our field, many times patients are even referred to us for distinguishing whether the person has any actual mental illness or whether he's just feigning or just malingering. So we are always in this system that we unconsciously keep on practicing, and we become experts in identifying. We see a patient and we know that he does not have any illness, he's just feigning. There are three terms we can rather say. One is malingering disorder, one is conversion disorder, and one is factitious disorder. Like malingering, sometimes army personnel are referred to us, and when they are assigned a particular duty with the gun, the duty is more of a bit harsh or hard to perform, like he has to stay awake for 24 hours. And sometimes these people start having mental illness or psychiatric illness, and sometimes they just feign it. So they are referred to us by the military personnel, and we assess them. We keep them in the ward for just observation basis. We make a day-to-day basis report on the postgraduate student is responsible for making the report, and after a week's assessment, that is called as mental state examination, we come to a point that whether he's suffering or not. And similarly, conversion disorder, like in India, in our society, there are certain possession syndromes, ki munhe mata aa gayi, something like spirit. Yes. So that also that is different from malingering. That is due to unconscious conflicts the patient is having, and those conflicts are driving him unconsciously to do such acts. It is not that the patient is doing it voluntarily. It is out of his control. So conversion is in itself a disorder, but it has been stigmatized to such an extent that we all people think that it is something that should be dealt with by taking into babas or witchcraft and all that.
And I mean, going with what you said about stigma, there's another important stigma that we never talk about, and that's mental health. We don't want to go to a professional. We don't want to talk to them. So I'm sure, have you also experienced this hesitation in your patients in coming to you? And do you think that there's a socio-economic impact that, what the person's background is, that really affects how willing they are to seek help?
Yeah, I can relate to you on this because my setup has both these stigmas associated to it. It is a very famous hospital in Amritsar. It was to be called as mental hospital earlier. So to destigmatize, it has now been renamed as Institute of Mental Health. So the type of people who come there feel very ashamed whether to go to mental hospital or not, whether to talk about what you're suffering from is really important or not. And then they are the people who are very poor. They cannot actually buy medications.
Okay.
And on the top of that, it is considered that mental hospital patients are generally psychotic. There are two sets of patients, as we all know, that neurotic patients and psychotic patients.
Okay.
Psychotic patients are the ones who might be aggressive. They might not even know that they are doing so, and they have a mental illness. They are acting in such a way, their behavior is disruptive and causing harm to others. So because of that attached stigma, even neurotic patients who are actually suffering do not come to us. They hesitate coming up to us, and then they hesitate following up with us with the medications also. So that becomes really problematic, and to make them aware that it is okay, you can come, you can actually open up.
Yeah.
We are for you only. This is where we work.
Yeah. So do you go out and talk to the public, or do you organize any kind of these talks, where, or is it just word of mouth that, one person is convinced, they come and talk and they're like, I was helped? Or do you actively go out into society and, talk to these marginalized groups or people who are not coming in because they can't afford the medication or they're scared?
So basically, there are different systems where we work. She is working in a government setup. I am working in a private setup.
Okay.
So in every setup, there are certain camps that happen on a monthly basis, or we go to the different societies. And in those camps, the motive or the aim of those camps is to sensitize the public and dispense some information related to mental health. And even sometimes it happens that some NGOs get attached to us and they perform some kind of plays. In Punjabi, they say Nukkar Natak. They do that. They describe some incident. They can take an episode of a psychotic patient or of a drug addict patient. They describe it.
Yeah.
And through these acts, patients get sensitized. They become aware also that they have an illness. So these kind of camps, these kind of activities do have an impact, and most of us are involved in some point of the other in some camps. So this is the way we all approach. We go to the marginalized section of the society who cannot come to us, who are not aware of their illnesses. And second, mouth to mouth, that people come, they know, they get treated, they feel better, and they will. Some people also come back telling that I have brought this patient. They might not be knowing that I am a psychiatrist, but they know I am the person who can treat his illness. Sometimes they are not able to understand the meaning of psychiatrist because these words have been given by foreign countries, psychiatrists, psychologists, counselors. And here in UP, there is Manorog and Mastishk Rog Visheshagya. In Punjab, rarely Hindi is used, so people call him Mansik Rogi. So Mansik Roka, they doctor. So people sometimes do not know who is a psychiatrist. They just know, they become aware and they bring a patient, says ki wo doctor sahab hai, he is the doctor who can treat your patient if these are his symptoms.
So when we talk about sections of society, there's also the so-called the upper class society, where we see many a times people are going for counseling regarding marriage, career, some therapy sessions. But we see that, do you think it's important that at some point they should be more open to come to the psychiatrist? Do they really need it? Or do you think that just counseling would solve their problems?
I think in all the IIT sectors, all the multinational company people work, it is good to keep up with their good mental health with the counseling and meditation exercises they do, the psychotherapies they attend. That is good to maintain a good mental health. But as I told you, anything which is impairing your functioning, your socioeconomic, occupational, and your personal functioning, the first person to visit is a psychiatrist. He might understand and work and liaison with you, decide with you whether you need treatment or not. And these are the sects of people who have night shifts. So apart from stress, we are the ones who deal with sleep medicine. We can help them out with their sleep related problems, their coping problems, their focusing problems.
Yeah. So do you think that this overexhaustion at work also is like a stepping stone, or it will eventually can lead to these kind of disturbances, or like people having like serious episodes in future?
It is actually causing a lot of disturbances these days as well. So yes, I would say if you are in touch with your mental health professional, either uh, physically or via internet, via good mental health professional, good resource, qualified psychiatrist, you should be in touch and you should be following them. But if in particular you have specific problem, you need to have a tailor-made treatment. You need to discuss it separately physically with your psychiatrist.
Yeah, so to kind of clarify what you just told us about, meeting a psychiatrist. We as doctors, as PhD students, researchers, scientists, we experience a high stress environment on a daily basis. And we're often, just like doctors, responsible for lives. Like, if you're developing a drug product, or if you're working on model organisms to study something, that comes with a high deal of responsibility and pressure. And it is this challenging environment that gives rise to several ailments, these stress related problems like PCOS, which is polycystic ovarian syndrome, anxiety, gastric ailments, panic. So do you have a tip on how to control all of this? And what is the time? What is like the exact time you feel that, we should go and see a psychiatrist and we should seek all this digital or in-person help?
Right. So yes, we have that responsibility as researchers, or any person in in pressure work has the responsibility of coping up and performing well. But at the same time, we need to know that we are human beings. We need to take care of ourselves as well. No matter how busy the schedule is, we need to have a 3 meals course to follow. Eat on time, always sleep on time, no matter what. Drink a lot of water, have a brisk exercise session for yourself in the day. Avoid caffeinated drinks always. And at last, always have that rest, no matter how busy you are, how busy your schedule is. You need to figure that time for yourself. And yes, if you are having problems, anything, I personally feel in mental health problems, things start with disturbances in sleep. I think that is the marker where you should understand that it is being persistent and it is increasing. That is the marker you are supposed to go to the psychiatrist. And you should seek help.
I would like to add what Dr. Malvika said. You should highlight that a cup of coffee has a half-life of about 4 to 6 hours. That means if you take a coffee in the evening, even around 4 or 5, that will last in your blood or your brain till about 11 in the evening. So that can hamper your sleep, because people think I took the coffee 4 p.m. so that won't matter, but that does hamper your self.
Yeah, I see why you're adding that, because you saw me smile at the caffeine part. And I was like, no, I'm not going to leave coffee.
We do think these are temporary things which we can cope up with.
Yes.
But eventually they do disturb our sleep architecture.
No, but definitely we think like sometimes when we have less work in the lab, we just work on the desk and then we don't realize we have so much coffee. And then when you go home, it's hard to fall asleep. That's true. Okay. Now I know the answer.
Further to add that during the pandemic, Charu talked about over-exhaustion at work. It was the doctors who faced the brunt, and we were at the back foot, because we as psychiatrists were not the front line in managing directly those patients, but the people like the chest physicians, medical specialists, or the emergency critical care specialists. Even many of them came after the pandemic started, and with time they gradually started coming to us that I am having sleep disturbances, I am having depressive illness. So that exhaustion somewhere or the other has led to a massive increase in such incidents in doctors fraternity, whoever is involved along with them, nurses, paramedical staff, even the people involved in COVID testing in the government setup. One of the doctors, she fainted because it was like a camp. A tent was put, and she was in severe in proper summers, 45-degree temperature. She was taking samples, no AC, no cooler, nothing to drink, because after you wear the TPE kit, you are unable to eat, you are unable to pass urine, go to a toilet. So that brunt has been felt by the medical fraternity. And apart from medical fraternity, anyone involved in, she mentioned about MNCs, multinational company, you people who are involved in working, we will suffer once in a lifetime. So we need to be more cautious, as she mentioned, like sleep hygiene, eating time, etc.
I just want to kind of highlight one thing that we've touched on is insomnia. And now, as you also have a YouTube video on explaining insomnia as an actual disease, and it's very interesting because so many of us have sleeplessness, and we don't really consider it as a sign that, if you're having trouble sleeping, we are normally like, yeah, okay, just meditate, breathe, relax, stress hai, ye hai, wo hai. But there might be something deeper to it. And I would recommend that everyone watches that video. We'll obviously link it. And it's probably one of the, as you said, it's the first sign that you need to go seek help.
Yeah. You were mentioning before, because of the busy work life, especially for people who are in healthcare or even scientists. So sometimes it happens that we get so used to of our busy life that anything we get very less time for ways to keep ourselves healthy. And of course, exercise is one way. And another thing is to have a good, healthy social life. In general discussions, we hear that many times sometimes it happens that people think that that's why it's better to stay unmarried, or couples plan that because the work life is so busy not to have kids because it would be difficult. So do you think that this kind of family dynamics has also something to do with mental health?
Basically, having a society is good somewhere, somewhere it is good. You have a social circle because it is always supportive. You maybe it can support you in any form. A psychotic patient can be helped. He can be brought to a doctor through a social circle. Likewise, a neurotic patient, he can be motivated to go to a doctor. But at times it is important which circle you choose. You should always be choosy in circle, because in these days people are very fragile, and just a wrong circle can let you in a path that is a bit not good for you. Like drug addiction, it always starts from social circle, and it always ends up patient becomes isolated at the end, because that social circle who made you initiate drugs never visits you in the hospital, never accompanies you for treatment. So people end up in a very bad state. So it is very important. You should always focus on choosing a good social circle. And second, you mentioned that Samriti, somewhere people are postponing marriages. Age limit has been increased. Why? It is standards have been set by ourselves only, because we are intellectuals. We keep on working, and day by day the age bar is increasing, age limit is increasing. And secondary, even after marriage, like you talk, people are willing not to have children. So this somewhere has created mental health issues. Delayed marriages in itself, like you get married late, your body changes accordingly, and when you plan a baby after that, after delayed marriage, you will have issues related to fertility. You will have many issues both in females and males, and that can be a secondary cause to many mental health disorders. So if a couple who has been married for long and they are not able to conceive, that can in itself be a stressful event, and that can precipitate any episode of depression in any couple. Likewise, a person who is not able to get married, and due to that, somewhere or the other, he is stressed, and because of that stress, he's roaming around somewhere and he's just wasting his time. And sometimes we counsel him. So it happens. So they're taking it on a serious note. Yeah, everything we set goals for us that I want to finish my MD first. I want to have a good career. Only then after I'll get married. So what I have seen, marriage should happen on time, and you should not. This is professional life, personal life. Both should go hand in hand. We should not wait for ki I'll do this and then I'll start this. More time might never come, and we at a time will come we may मतलब हम पछताएंगे बाद में, we मतलब we feel remorse कि I should have taken that action.
Yes.
So it is just a personal thought. Many people have different views. We can debate on it for long.
Yeah, I mean, there's this, there's also a habit of obsessing and over-analyzing, overthinking. So, because as a scientist, I will say I'm trained to continuously think, to go over various scenarios in my head about an experiment or like, what the larger impact of my study is going to be. And then this eventually becomes a habit. And like, as you said, people are very specific about their needs. And some of us, because of the kind of workplace that we are in, we just start liking the solitude eventually. We're like, it's just better not to talk to anyone. And these are obviously, when I'm saying it, I feel that this is wrong because this is not how humans are supposed to be. We're a social animal. But so do you think most of the symptoms that that you face on a daily basis are just a result of people over analyzing and overthinking, and it's just in our hands to reduce this mental burden?
Partly, yes. Initially, we have that power to rationalize our overthinking. But eventually, if it is out of our control, then obviously we are not doing it by purpose. That is actually disturbing us. So that needs treatment. Initially, we think we can control, we can distract ourselves from the thought, or we can filter it out and we can think of something more important in our life. But slowly and slowly, if you are already vulnerable to it or prone to such things like your personality or your traits, your personality has been framed because of situations like this, maybe your work, your career, maybe your parenting. They were also over perfectionists, and then you landed up being such. So you set up higher bars for yourself.
Right.
Because you've been brought up that way, you know how to cope with it. There are certain limits. There are certain stressful situations where you cannot cope with them. Then you need help. At those times, you need that guidance.
So this is like personalized medicine. It's
Right.
not one size doesn't fit all.
Right, because like normal pulse rate is 6200 is 6200.
Yeah.
But then personality differs from person to person. If I am an anxious type personality, might be you're not. You're a person who'll take things in a lighter way. Then you need to be dealt in a different way. If you go through a crisis, I need to be dealt in a different way. Maybe a small little thing can impact me in a bigger way, and that thing might be very trivial to you. So it will be very personalized.
Yeah. To add to this, like she said, a trivial thing can become a major stressor for someone. Many people, because we have a chunk of rural patients, many times patients come and say, one of a girl comes and she was just 12 years old. She was just crying and her calf had died due to some illness. And that girl, she was so much attached that the cows are treated, or buffaloes are treated as family members. So I could not feel that pain because I have not even managed cows or buffaloes at home, but someone who is attached. So coming back to the point that something that can be trivial for someone, or the same thing can be a major stressor for the other. So it is not, people sometimes laugh. Many times we are bullied even in school times or even in college time. Why is he depressed? इसका ऐसे हो गया था या कुछ है. But the inner mind state of that person can have, it might be compromised due to just a small stressor, and others might bully him ki why is he feeling so much, why is he doing that. And this is the reason why suicides happen, because due to such bullying, they become more fragile, and they end up that I cannot tolerate because everyone is teasing me. So it is just a vicious circle, you can say. So we need to be aware. If society becomes aware of the mental health symptoms, if
Yeah.
that everyone has a different level of mental health, and only then we can progress as a society.
Yeah, yeah, to normalize talking about this and, just being more empathetic, I think.
So many a times it happens like an uncontrolled overthinking can lead to either anxiety or depression. So does a person really need to be medicated over symptoms of anxiety and depression? And if they do need it, then what is the criteria? Like, how do you decide if the psychiatrist has to handle it or the psychologist has to handle it?
See, Samriti, when we talk of overthinking, overthinking can be a symptom of different psychiatric disorders. Overthinking in itself is not a diagnosis, it is not a disorder. Okay? Many times it happens that overthinking is most commonly associated with OCD. OCD is basically obsessive compulsive disorder.
Yeah.
OCD people have a knack of thinking too much and thinking about too much about everything, like why is this, why did this happen, what should I do, should I do this, should I avoid this. They have a knack of keep on thinking that the thought keeps on rotating in their minds. So this is a normal tendency for them. Only when the thoughts become so devastating to their mind that they start damaging their personality, they are unable to focus. Like she said, that personal occupational dysfunction happens. They are unable to sleep. They are unable to focus on their jobs. They become irritable. They become, at times they become violent and aggressive also. So this is the point we start the medication. And when you talk of whether a psychiatrist should be contacted first or whether the psychologist, so I being a psychiatrist, I will always recommend that psychiatrist is the best person, and psychiatrist should be the first person a person should visit, because many times it happens that where we live, I have seen that unqualified people are practicing as psychologists, unqualified people are practicing as counselors, and through just mere publicity stunts, they become renowned and people go to them, but they do not have any knowledge, and such patients land up in such a way that they become so severely ill that we are not able to help them at that point. So at this point of time, when there is a dearth of qualified professionals, it is always the psychiatrist, because psychiatrist is always qualified, because we have a degree, we are MBBS MD. Expertise of the psychiatrist can never be questioned, so he can further recommend him to go to a counselor or a psychologist. And criteria are different. For depression, we take different criteria. For 14 days, sadness of mood should be there, fatigue should be there, anhedonia, basically not able to enjoy pleasurable activities, decreased sleep, ruminations. So criteria are different for different disorders, but the basic is that we always measure the amount of socio-occupational or personal dysfunction. This is the crux.
To add on to this, even if we know we are in touch with the psychologist or a counselor who is actually trained, if you are in a crisis, you are not able to even listen to somebody in a peaceful mind. You will not be able to have that gain from counseling or psychologist, from any psychologist. But that time you need to have your nerves calm down by medication. Thereafter, you will be more amenable to accepting to all those psychological interventions and counseling.
On that topic, your venture Piyushika was started as a medium of educating people about such brain disorders. And you make several videos, as you said, in India's local languages also, to reach a much wider audience, to have like a personal relationship there. So, going by an aspect of our conversation we've already had, I'd like to contrast your work with the so-called life coaches who have undergone some or no training and are handing out mental health advice to everyone on the internet. So are these social media influencers a boon or a bane? Are they helping bring mental health awareness, or are they just making a mockery of the whole situation?
Yes, there are people who are not trained and they are actually unqualified and giving advice outrightly to the public. But I would also suggest to the public to choose their resources wisely, their mentors wisely. Psychiatrist, a specialized person who's actually talking about the content of his own speciality and not breaking his or her own boundaries.
Yeah.
And to add to that, any mental health professional will give justice to any topic in a more generalized manner on social media. A person who has a specific issues, specific problems he is going through will have more benefit when he goes to the doctor himself or herself, opens up. Only then a doctor can give a personalized treatment or a tailor-made treatment for that person.
Yeah.
Medicine always we know that each patient is unique and their situations are different and we need to deal them differently.
Yeah. I mean, I don't want to sound biased, but I mean, with the conversation that we've had till now, it's more than skin deep, right? So there could be emotional problems in people's past, like the first example that you gave of a breakup. Maybe their mom had a divorce. Maybe they've had a difficult family life. And so these things are just very much serious. And like you said, Malvika, that a person needs to sometimes be medicated to accept this counseling help. And talking alone does not help there. And, you know, there are several startups where people... so these are these apps and where people just want to bring people together to talk, to share their feelings, and nothing wrong with it. But at the end of the day, the advice that you get there will not work for everyone and everyone will not take it.
Might not hit you specifically.
Yeah. And then it might just entirely be misleading. And so, I mean, you know, there's a lot of advice that I have seen from people. And it really, I mean, honestly, to me, it just seemed like these are people who want to be Instagram famous. You know, they want to say these big words and quote these big people. But saying all of that, and then, you know, people have to agree with it, right? Like, oh, a smile a day will make your day better. Everyone knows that if you keep smiling, you'll feel nice. But, you know, sometimes just smiling is also empty. And when people start commenting on these and, like, you know, if they try to say that, no, I'm not getting help, they don't really get that help. And you feel so much social pressure to accept whatever is given. I mean, that's also a reason why I brought this up, because you are professionals, you are trained medical doctors who had to undergo a training of a counselor, a psychologist, and also someone who can prescribe drugs. So you are well rounded in this field, so you know what you're talking about. And so I think your point of people being smarter about, you know, what kind of advice they are taking is so important.
I generally talk to patients and tell them, if you Google about your medications regarding your hypertension, diabetes, they would say outrightly say no. So I always say that you've taken the advice of a person you don't even know about, and you've taken it as a treatment for yourself. First, have that trust in the person you're following.
Yeah.
Always choose your professional first. Even if you're viewing a video, you should always learn about that person prior hand. You should know about that person who is dispensing that information. Blindfoldedly, you should not just start following that person or whatever he says, because it can mislead you. Many times there are coaches and motivational speakers these days. This is a commercial trend. This is just a commercial property, I would say. If such kind of people go in the political field, they will become very good political people. They'll motivate the audience and bring many votes for political parties. They are such kind of people. They are such personalities. They will always be leading the other people. Even a riot happens, that those will be the people who will lead others to start a riot. So it is their personality. They are doing such things, but always follow if that person is qualified or not, whether he is related to mental health in any way or not. If he is related, if he is a counselor, if he is a psychologist, if he is a psychiatrist, I would say start following them. But if out of these three, if he is nowhere around, he's just a +2 pass, or he has just done some kind of degree to 1 month course and he becomes a counselor, that is very wrong if we start following him, because he won't be helpful. He will always mislead you and you will be on a wrong path.
Yeah, that's true.
Yeah. So what Charu mentioned in the beginning, it definitely is that we are in a dire need of more psychiatrists in India. Like the ratio at the moment doesn't sound very good. So do you think that there is a need, or are you yourself thinking of any ventures to promote young doctors so that more and more people are willing to take this as a speciality so that we could fill in that gap?
So basically, we cannot say that we are motivating young people. We are ourselves at this point. We are very young at this at our age limit. I basically work in a private setup. I have undergraduate students who are coming to me. So I try to make them establish rapport with psychiatric patients, let them observe what psychiatry is. So they might be interested at some point of their life when they pursue some postgraduate degree. They might prefer psychiatry in comparison to other fields, because due to the earlier stigma attached, even many people from our fraternity, when my counseling was happening at that time, I had to choose these fields. Many people, if you remember Samriti, there was Shipra. Her rank was a bit more than me. And when I asked her, what will you prefer? She said, I won't prefer psychiatry because my parents do not want that I should become a psychiatrist. Even such intellectuals, sometimes they say such kind of thing, then it hurts that when everything is your body, your brain is your body, your heart is your body, why is you are distinguishing between your heart and your brain? When a heart has some illness, you go to a heart specialist. Likewise, a brain has an illness, it presents in form of psychiatric disorders. So why do you refrain yourself from visiting a mental health professional? So go for it. Do not attach stigma to it. Just get treatment. And these days, medications are so good that patients become totally normal. I won't say 100%, but 70 to 90% patients get well very well. And those 20 to 30% patients are in every field. It is only psychiatry that a stigma has been attached, and due to that stigma, it is not progressing somewhere.
So in relevance to this, normally what we have learned is that like any kind of neurological disorder, any kind of damage is always hard to repair as opposed to any other damage of the body. Are there certain psychological these disorders which are also irreparable, but with medicines you can just bring the symptoms slightly, ease them off?
As I already told, that there are neurochemical and pathways and neurochemical disturbances and imbalances which we need to deal with. It is always depending on the situation of a particular patient we are seeing, the severity which we are being presented with. So that is where we can work upon. If a patient is more on neurotic disorder, we can actually bring him back to his self, and he can actually be motivated to, he can understand this is a phase of my life.
Okay.
In contrast, psychotic patient might have a unacceptance from his family or express emotions from his family that he will never be okay. The expectations about him being okay would be different from a person who has a stress or anxiety or depression.
Right.
So we need to psychoeducate them, first of all, that what the illness is actually and how you need to deal with the patient, and how you are supposed to be guiding the person in contrast regarding, feigning him, or that he's just lying, he's just doing it, he just wants to be abusive, he just wants to be violent. They need to accept it as an illness so that they can start the treatment and follow the treatment. Even though the treatment is long, they need to be patient about it, and slowly and gradually symptoms do resolve. There are people who take lifelong treatment for diabetes. There are people who take lifelong treatment for hypertension.
Yes.
Same goes with the mental illnesses.
Yeah.
And to add to this, what you were asking, that the neurological dysfunction is not reversible at times. Actually, our psychiatric disorders does not have such kind of neurological dysfunction that there is permanent damage of neurons, and whether how can we regenerate those neurons. Ours is a bit different. We have at the molecular level, or what she said was at neurotransmitter level. Basically, neurotransmitters are neurochemicals. You are better aware of that, like serotonin, norepinephrine, dopamine. We can say in Munna Bhai's language, there is chemical locha. Basically, we keep on correcting it via drugs, because, like, for example, if serotonin is altered, we give selective serotonin reuptake inhibitors. They are called as SSRIs. They basically act in a way that they will increase the release of serotonin in the mind, and in that particular area where there is deficiency, and that increase will lead to your happiness or something,
Your
their
mood
symptoms.
changes.
But in certain disorders like schizophrenia, it happens that 100% of the symptoms at times are not improved, but the patient with medications comes to a point where he can live independently, he can take care of himself. But if the medications are not given, I bet 100% of schizophrenia patients will be on roads, and those 100% of the patients will be die in a pathetic situation. You might see patients roaming here and there on roads. They are in naked conditions. They are suffering without any clothes in winter. So they are basically schizophrenics. They have such level of dysfunction that we cannot alleviate it to 100%, but we can just alleviate some of the symptoms, or we can say 60 to 70% of the symptoms. At times, 100% of recovery is also seen. So it is the schizophrenia group of patients, those we find it difficult to treat. At times we use ECT or the electroconvulsive therapy or the electric shock therapy. So this is all the scenario regarding the neuronal relation of this.
Yeah, I mean, it looks like there's so much hard work, there's so much stress in your profession, and there's really this, other side that you have to be empathetic, you're sympathetic, you have to agree with the patient, you have to know that what may be trivial to you is so important to them. And so, as in the case of psychiatry, you said you educate your students about what psychiatry is, how you can go about it, you let them know the truth. Similarly, with all PhD, with all medicine students, we are all asked to think very carefully before we embark on this path, because it's so stressful. It's a lot of studying. You're responsible at the end. You have a duty, which is much more severe than, maybe some other professions. And many are discouraged just by hearing this. I mean, you mentioned a friend who's as an from a person from an intellectual family. Maybe she wanted to do psychiatry, but she was discouraged because of maybe its scope, the stress, the requirements that it needs from you as a person. So what is your advice to such students who are discouraged from picking up professions they like just because it's hard and stressful?
I would like to quote my own example. I wanted to be a physician because of my dad. Like, my dad is a physician, so I wanted to be a physician. I've seen his work. I've seen his busy schedule. During my internship, when I started exploring myself, started having more inclination to psychiatry. So I think it is not imposed decision about psychiatry to anybody. It should be rather proactively from the candidate who wants to take psychiatry, because the person who chooses to be a psychiatrist would always know the brunt of it, the pros and cons to it. And only then the person will be able to understand whether he is fit for the job or not.
Whosoever has some interest in psychiatry should always try observing the field for some time before making a decision. So it should always be an informed decision. He or she should know that after having worked in psychiatry, what she has observed, what he or she has observed, learned, dealt with patients, whether will he or she will be able to cope, will he be or she will be able to do that or in his or her practice for the entire life. Only after that he or she should take a decision. Because psychiatry is very subjective. It is objectivity is very less. You cannot do order some investigation and let know yourself that he or she is suffering from some kind of psychiatric disorder. It is always your assessment, your interviews, your way of approaching the patient, your way of making rapport with the patient. Observation should always be there before making a diagnosis, seeing some cases, learning about them, only then.
Yeah, as you mentioned that psychiatry is very subjective. So, and I think the kind of patients that you get during a day, I think it's very stressful as a doctor as well. So out of curiosity, do you think, or does it happen that psychiatrists at some point also need psychiatrists? Like you're so yeah, well, that's when you're a power couple, because if you both are psychiatrists, I think that that can't be any better.
With time, with experience, you learn to know your boundaries, when to dissociate, when to have that empathy, and when to like just cut off.
Okay.
You with experience, you learn to do that, but at the same time, your baseline personality, your baseline baggage,
right,
I think does not allow you to do that.
The problem is that even if we require any counseling or require any professional help apart from ourselves, we cannot go. How can we visit someone? It will be very difficult. Even if we visit a psychiatrist for our consultation, he or she will know, they won't take us seriously. The point is that even as doctors, when doctors visit other doctors for any kind of help, maybe like for example medical help, he will not take you seriously to that extent. Like he's seeing a normal patient, he'll always sway from the point you have come to me for consultation. So we always, from this point, we always suffer. We are not able to get good consultations for ourselves, or any kind of illness, unless and until it is severe.
Yeah, I mean, so I have a last and final, I think it's the most important question for today. So who's the better psychiatrist, Malvika or Piyush?
I think in both we are different. We cater different kind of population. We cater different kind of problems we are having with people. The common thing is the culture. We cater with Punjabi population. But I guess I cater with more of patients with schizophrenia and violent patients. He's more in addiction and patients who are having stress and anxiety and more depression. So we are equally good at it in what we do.
Mm-hmm.
Very diplomatic.
Yeah, I won't.
Yeah, well, I think that was very informative and also very thought-provoking in a way as well. So I think I really had a good session with you guys. I got to know a lot of things in that way.
Well, I mean, obviously, it seems psychiatry is the original personalized medicine. So thank you so much for giving us the opportunity to speak to you both today. And since this is a recorded event, I'm sure our listeners will have some questions. So how can they contact you? Email?
Email is good.
Okay.
And even you can mention about the channel Piyushika Mental Health Guide.
Yes, yeah. I will do that.
They might comment upon what the needs are, so we can actually
and we have a
personalized touch with
Facebook.
them
They can connect on Facebook also. Facebook IDs we have as separate by our names, and also by Surekha's Mind Heal Clinic. Also, there is a Facebook ID, Facebook page.
The page.
Surekha's Mind Heal Clinic. So they can post something if they want to ask. So
yeah,
we can.
Then obviously get off the platform and be personal with them.
Yeah. So what we'll do is that we'll put your email address and more importantly the information for Piyushika, and maybe everybody can. I think the best way then is to just comment below the videos, and then you would get back to them. I've seen that you are very active with responding to people's questions. So we'll have all of this linked with the podcast, and Piyush and Malvika, do share your feedback with us as well, and all our listeners can also share their feedback on biopatrika.in@gmail.com. And so now we take your leave and hope you will tune in again for our next interview soon.